Welcome. The following recording is presented on behalf of the New Hampshire Department of Health and Human Services, Division of Public Health Services, Bureau of Family Health and Nutrition, Nutrition Services section. Content provided will be an overview of how WIC works, how WIC supports healthy communities, how to apply, and resources available. WIC is a federal nutrition program that is part of the USDA Food and Nutrition Services branch. WIC's mission is to assure healthy pregnancies, healthy birth outcomes, and healthy growth and development for women, infants, and children up to age 5 who are at nutrition risk by providing nutritious foods to supplement diets, information and education on healthy eating, breastfeeding support, and referrals to healthcare and critical social services. WIC services and benefits ensure that children get a strong, healthy start in life. There's clear evidence that good nutrition during pregnancy and in the first few years of life has long-term positive impacts on health. WIC is our country's most successful public health nutrition program. 6.2 million women, infants, and children participate in the WIC program nationwide. WIC provides wholesome food, nutrition education, and community support to income-eligible pregnant women, moms of infants, and children up to 5 years of age. Categorically eligible women, infants, and children who participate in Medicaid, TANF, or SNAP are automatically income eligible for WIC. Most foster children are also on Medicaid and are automatically income eligible as well. Families that do not participate in Medicaid, TANF, or SNAP may still be income eligible based on their gross family income. They will need to show 30 days proof of income for income eligibility. Families with active Medicaid, SNAP, or TANF are adjunctively income eligible and do not need to show 30 days of income. To help with the process, New Hampshire WIC has coordinated with Medicaid and SNAP to utilize a data sharing system. Families determined eligible for New Hampshire Easy are referred to the New Hampshire WIC program, and WIC staff reach out to families. The DHHS WIC website has information to prepare families on what to expect for their WIC appointment. Families can access WIC by calling the local agency directly to set up an appointment or physically go into the main office. Families also have an option to use the online pre-application link, which is available on the DHHS WIC website. It is determined when the appointment is set up if an interpreter is needed for the appointment. Examples of services available if an interpreter is needed at the New Hampshire WIC local agencies include a telephone interpreter line, in-person interpreters, or an American Sign Language interpreter. Families then meet with WIC staff who will review and document income, identification, and proof of New Hampshire residency, review program rules, participant rights, and responsibilities, weigh and measure each family member applying and screen for anemia, support primary care providers in providing lead testing to 1 and 2-year-olds. New Hampshire WIC will also screen pregnant women and older children, talk with families about their nutrition interests and goals, learn about nutrition resources, and receive food benefits along with the eWIC card and shopping information, and refer families to other health and community services. WIC provides 4 core services, including nutrition education. Families meet with a nutritionist with the goal to help and support families to make healthy changes by using motivational interviewing. Breastfeeding support by promoting breastfeeding as the optimal form of infant feeding. Healthy foods by providing families with a healthy variety of foods needed during times of increased growth and development. And referrals to health and social services by helping families find the resources needed when they need it most. Currently, WIC Smart online nutrition education is offered to low-risk children from 13 months to 5 years of age at the follow-up nutrition appointment. Having an online option keeps families engaged in the WIC program and offers another way to get education and benefits. The online education option eliminates up to 2 visits per year for eligible children. The WIC program promotes breastfeeding as the optimal first food for infants. Breastfeeding rates have risen dramatically over the past 20 plus years. The current WIC infant and toddler feeding practices study found that in 2013, the breastfeeding initiation rate was 83%, an increase from the 56% who reported initiating breastfeeding in the original study conducted in 1994 and 1995. Although there has been success with initiation and breastfeeding, there are barriers preventing families from meeting their breastfeeding goals. Barriers include social pressures, a quick return to work after delivery, lack of facilities to breastfeed or pump in the workplace, and targeted marketing by the infant formula industry. WIC has been successful in supporting women with the initiation of breastfeeding and is leading efforts to increase breastfeeding duration by increasing participants' breastfeeding knowledge, confidence, and support. To provide support, each New Hampshire local agency has a designated breastfeeding coordinator that oversees the breastfeeding program and are also certified lactation counselors. Many of the WIC nutritionists are also certified lactation counselors. And each local agency has breastfeeding peer counselors that provide peer support to WIC participants by in-person one-on-one counseling to phone support. Peers provide a key role in breastfeeding support for the WIC participants, not only in clinics, but also providing after-hours support. In supporting families in their breastfeeding journey, WIC can offer manual pumps, single-user pumps, or multi-user pump if needed. Our goal is to meet families where they are and to provide the support needed to meet their nursing goals. The breastfeeding rates shown for the US and New Hampshire are from the CDC National Immunization Survey, while the New Hampshire WIC rates are from the New Hampshire DHHS data portal. Initiation rates in the US have risen dramatically over the last 20 years. You can see from the Ever Breastfed chart, years 2017 to 2020, New Hampshire does very well with breastfeeding initiation as a state and in the WIC program, but by 6 months the numbers drop, especially with our families of low income. Some of the common barriers are insufficient breastfeeding support, returning to work early, and not being able to have the opportunity to build a good milk supply. These are just a couple of the factors that contribute to this decline. In addition, WIC breastfeeding rates may be lower due to families not knowing that WIC is an option for them during this time. Some families may think of WIC as only providing formula and not know that a mom breastfeeding can get a food package in addition to support and other resources. WIC enrolled participants get monthly food benefits on WIC's EBT card to buy wholesome foods that help stretch the family's food budget at the local grocery store. WIC nutritionists share tips on how to shop and prepare WIC foods. The foods provided for the WIC program have to align with the WIC federal regulations. The slide shows the general food categories that families can purchase with their eWIC card at the stores. The state chooses which foods are included in the New Hampshire food booklet and approved product list. The food booklet is reviewed twice a year. Not included on the slide, but also available, are alternative milk options, including soy milk, tofu, and lactose-free milk. The New Hampshire Food Booklet and approved product list can be found on the DHHS WIC website and on the WIC Shopper app. To assist families with a better shopping experience, New Hampshire WIC utilizes an app called WIC Shopper that can easily be downloaded to any smartphone. The app has a variety of features including viewing current benefit balance, eligible WIC foods, scanning foods to see if they are WIC eligible, calculators to help manage ounce allotments of cereals, clinic locators, store locators, notifications for when benefits expired, recipes, and life hacks. In addition, the WIC Shopper app also provides a variety of languages for families to choose from. The WIC Shopper app has been another tool to help WIC get information out to families quickly by placing messages on the banner and notification feature. New Hampshire WIC nutrition data is obtained from the WIC Management Information System, or MIS. Up until 2011, data was collected by the CDC Pediatric Nutrition Surveillance Survey. After 2011, New Hampshire continued to collect data from the WIC MIS system and post the data on the DHHS website. The full reports for calendar years 2011 through 2022 are available on the DHHS Wisdom page. This page displays participation, behaviors such as smoking and TV viewing, breastfeeding rates, including ever breastfed, 6+ months, 12+ months, and exclusive breastfeeding, and health topics such as obesity, overweight, and anemia. The data displays for each county and statewide. The slide is showing changes statewide from 2011 to 2022. This shows a decrease in household smoking and increases in breastfeeding initiation and exclusively breastfeeding at 3 and 6 months. Extensive research shows that participating in WIC leads to healthier babies, more nutritious diets, and better health care for children, and higher academic achievement for students. WIC supports sound nutrition during critical periods of cognitive development to mitigate the harmful effects of poverty. New research shows that children whose mothers participated in WIC while pregnant scored higher on assessments of mental development at age 2 than similar children whose mothers did not participate. Participating in WIC substantially reduces the risk of adverse birth outcomes and reduces the risk of infant mortality. And WIC promotes breastfeeding as the optimal feeding choice and supports participants through their breastfeeding journey by providing prenatal education, early postpartum support, and peer counseling support. WIC positively impacts local communities in a variety of ways. WIC brings money into local economies with over 47,000 retailers in the US and 147 in New Hampshire. WIC brings healthy food to local communities, helps foster community partnerships that improve access to healthy food, and ensures that local health and social service networks are strong and efficient. WIC is a network built for families. WIC connects moms and caregivers to other moms, as well as nutritionists, lactation specialists, and peer counselors. WIC is for all moms and moms-to-be who meet income requirements. In fact, the WIC program serves over half of all infants born in the United States. The New Hampshire DHHS data portal displays program overview data for New Hampshire WIC and shows the percentage of those participants receiving Medicaid, SNAP, or TANF. New Hampshire WIC provides a number of value-added services. Learn the Signs Act Early developmental milestones monitoring was added for WIC at certifications and mid-certification appointments using CDC's milestone checklist. Developmental milestones are age-specific activities of how a child plays, learns, speaks, acts, and moves. CDC's milestone checklists allow families to track and celebrate the milestones their child is reaching. It also allows for early identification and referral for further evaluation when milestones are missed. The Learn the Signs Act Early pilot was launched at one small local agency right before the COVID outbreak. All of the local agencies implemented the program in September 2022. The Water Wellness Initiative is a project that aims to reduce heavy metal exposure among a vulnerable population, pregnant women enrolled in WIC. All local agencies implement water source screening at WIC appointments for families using private wells for their drinking water. Eligible participants receive a water test kit and prepaid mailing envelope to send their samples to the DHHS Public Health Lab. If their water exceeds the recommended amounts in any of the 5 heavy metals, a free water pitcher and replacement cartridges are mailed to the participant. For smoking cessation, the local agency nutritionist screened for tobacco use using 2 A's and an R. Ask, assist, refer. Participants that are interested are referred to Quit Now, New Hampshire. Innovative clinics. The WIC program is always looking for new ways to meet our families where they are at. By collaborating with Head Start and other programs such as Moms in Recovery, it allows the family to have access to multiple services at one appointment in the same location. USDA Breastfeeding Training Platform. This training curriculum was implemented in spring 2021. This platform allows for more up-to-date information along with videos to help educate all WIC staff, from program staff, nutritionists, peer counselors, WIC designated breastfeeding experts, and community partners. Next, we'll look at some ways families can connect with the WIC program. New Hampshire has 4 local agency contractors that cover the 10 counties in New Hampshire. Community Action Program, Belknap, Merrimack counties, covers Belknap, Coos, Grafton, and Merrimack counties. Goodwin Community Health covers Carroll and Stratford counties. Southern New Hampshire Services covers Hillsborough and Rockingham counties. And Southwestern Community Services covers Cheshire and Sullivan counties. Families can call the local agency that services the county they live in to schedule appointments. A quick tool for families to find a clinic near them is www.signupwic.com. They will enter their zip code and it will populate the contact information for the local agency that services the area where they live. The online pre-application tool allows families to reach out to WIC and start the appointment process. Applicants are asked questions about household names, home address, contact information, and language needs. The local agencies will receive notice and reach out to the family on the day and time indicated by the participant on their application. Available resources include the General RAC card, WIC income brochure with a QR code linking to current income guidelines, and tear pads. Please reach out if you'd like any of these materials. For additional information, you can visit the New Hampshire DHHS website, or for questions, call our main number at 603-271-4546 or email at wic@dhhs.nh.gov. Thank you for taking the time to learn more about the New Hampshire WIC program.